This is the Italian Citizenship Podcast, hosted by Marco Permunian and Rafael Di Furia.
Hello there, and welcome to another edition of the Italian Citizenship Podcast, presented by ItaliancitizenshipAssistance.com. Of course, we are back at it again with Italian attorney Marco Permunian. How are you doing today?
Good, how are you?
I am doing great, thank you. And today, we wanted to cover a very important topic and something that's actually a big draw for many people who are looking for Italian citizenship by descent or just interested in pursuing citizenship period in Italy. And that is the Italian healthcare system, rated as one of the top in the world as far as the healthcare coverage as well as quality of services that you receive. And so, Marco, let's jump into maybe just the basic ground level first. And how is that actually that somebody signs up to the Italian healthcare system on the public national system?
So the public national healthcare system is managed locally by an entity that is called ASL, which is Azienda Sanitaria Locale in Italian, which means local health company, even if it's not, of course, a private company, but it's to give the idea that there is an entity that manages the healthcare locally. And that happens within the region where there are like several ASL, so these local entities that manage the healthcare for that specific area. Normally it's the area covered by the province, but not necessarily. Now, when you sign up, you have to go and visit a local office, which is called ASL office, which is normally in the city, which is also the province of the area where the person resides. And it's necessary, of course, to be a resident of Italy to enroll in the national healthcare system, or at least to prove that you're in the process of enrolling as a registering as a resident in that area. The enrollment process is fairly easy. All you have to do is visit your local ASL office and bring proof of ID and share your address. And the enrollment is completely free of charge for Italian citizens. If you're a non-EU citizen, there might be a fee associated with your enrollment, which could be anyway in the hundreds yearly. And if you are an EU citizen, so a citizen of the European Union, of another European country, and a non-Italian citizen, then the enrollment is dependent on a few factors. For example, you will have to show that you have a job in Italy or that you're looking for a job. So you are registered with the system in Italy that is in place for people who are looking for an employment, or that you're enrolled in school. So in other words, if you're not looking for a job, if you don't have a job, and if you're not enrolled in school and you are a non-Italian but European citizen, so a citizen of another European country, you may not be entitled to register, enroll in the Italian healthcare system. If you're a non-EU citizen, on the other hand, you will have to have a residency permit. So if you have a residency permit, a work permit, or other types of residency permits that are made available by the Italian government, the registration normally happens based on the fact that you have a residency permit. And of course, if you're an Italian citizen, you just need to be registered as a resident in an Italian municipality.
Thank you for that explanation as to how to sign up for the system. I can say, as somebody who's been on the Italian system, it's absolutely amazing to be able to have access to. And I was very surprised at how easy it was to, in fact, sign up. And sometimes the line could be longer than the actual sign up process itself, and selecting your doctor, your general practitioner, and so on, and even understanding about the hospital access. But on that topic, how is it that you actually access these services once you are covered on the national system?
So since we are on the subject, when you enroll, you will be asked to choose a general practitioner. So that's something that you do at the very beginning when you enroll. And if you don't choose, you will be assigned one. But generally, you're asked to choose between a general practitioner in the area where you reside, and that will be your point of reference. So the doctor that you will go to when you have, for example, to talk about general problems, health problems, or if you want to book an appointment with a specialist, or if you have to get a prescription. And the appointments with your general practitioner are completely free of charge. And I remember a few years back, what you did, you were just going to his or her office and just wait for your turn. There were like quite a few people and you had to wait. But now things improved and you can book your appointment very easily online. So there's basically no even line when you go and you just book a time to see your general practitioner and everything happens very quickly. And the general practitioner that is assigned to a person has a very important role because, like I said, it's the person that you go to when you have to get a prescription or if you have to talk about like general health problems. But make sure that when you book the appointment with your general practitioner, you understand the days and times during which the doctor is available, because generally speaking, a general practitioner will be only available on certain days of the week or times of the week. And it's also important to clarify for people that when your general practitioner is unavailable, for example, he or she is on vacation, there will be a replacement that is available for you, or for example, during the summer vacations, or if your doctor is ill, there will always be a replacement that you can go to for your general needs. Even though most doctors will accept appointments, there are still some doctors that do not do so, even if I'd say the vast majority of doctors accept appointments now. But depending on your doctor, you might have to go to their office and wait in line. However, I have to say that in the recent years, things got very much streamlined, and now you can even contact your doctor via email or telephone. So if you have to renew prescriptions, you can just give your doctor a call or send him or her an email, and they will send you the prescription via email. Also, a lot of regions have a new system in place where they will send your prescription directly to all of the pharmacies of the region. So it's even easier. So if you want to get a prescription or if you have to renew a prescription, you can send your doctor an email and then you can just show up at the pharmacy and the pharmacy will have your prescription already on file. You just have to give your tessera sanitaria, which is your health card that is given to you when you enroll in the national healthcare system, which is attached to your tax code and connected to your tax code. So you give that and the pharmacy will already know that you have a prescription. The second after your doctor sends it in the system, everything is done automatically and it's very easy and fast.
Thank you again, Marco, for explaining that. That's, again, as somebody from the US and learning about the Italian system, having that experience in Italy of how things work and how things will go at your visit was definitely an adjustment, and also even not having to pay for the general practitioner's visit. That's huge. I mean, that was the biggest surprise for me. I've mentioned it a number of times on this podcast as well as my own. But so far we've talked about private visits when you are going, well, not private, but individual visits when you're on the public system at your general practitioner. But what about if you need emergency services or if you have to have some type of specialist visit at the hospital? How does accessing those services work?
I think it's worthwhile just very quickly to mention something that is in between the situation where you have to go to your general practitioner and the hospital. So there are situations where you will need to see your doctor, your general practitioner, but it's nighttime or the weekends, and the situation is not as urgent, which means that you don't want to go to the hospital because the situation is manageable, but you do need to talk to a doctor as soon as possible. So in Italy, the healthcare system and the healthcare in general is guaranteed by the constitution. So the Italian government really makes a very good job with ensuring that a doctor is available to you at all times. So if you need to talk to somebody that does the same work as your general practitioner in the night or during weekends, you can go and see this guardia medica, which literally translated means medical guard. So that will be a general practitioner. Is not your general practitioner. It's somebody that is available to the general population in the region. And if you have, for example, the flu, a very bad flu, and you need maybe a quick prescription, or if you have a plugged ear, for example, and you need a quick prescription for some medicine that will help you, you can go to this Guardia Medica, and there is one in every area in Italy, and they will help you, and they will tell you if you have to rush to the hospital, or they can help you with some quick prescription. But going back to your question, if you have to rush to the hospital, first of all, I think it's going to be helpful for people to know that ambulance rides are free of charge in Italy. Now, let's say you rush to the hospital with or without the ambulance. The services that are provided by the hospital will be mostly free of charge or completely free of charge for some categories of people. Normally, in a normal situation, a private citizen will have to pay a small amount. It's normally less than 50 euros, depending on the service that is being offered, depending on the situation. It could be as low as a few euros and as high as 30 to 40 euros, depending on the region. That's called tickets. It's similar to a copay, I believe, in the US. So it's a way for the general population to contribute to the to support the healthcare system in Italy, which is free of charge for many people, or almost free of charge for other individuals. For example, if you have a very low income, or if you're a person over the age of 65 or under the age of 6, the medical care is basically free of charge. Of course, we're saying free of charge, which means it's actually free of charge for people who get the medical care, but the entire system is supported by the taxpayers. That goes without saying. Also, the need to pay a ticket is based on the severity of your condition. So if you rush to the ER, you might be assigned 5 different colors, but most people will end up being assigned a red code, which means you are in a very severe and urgent condition, or orange, which is a level right below the highest level of severity, and white means that it's not urgent at all. So most people will be in one of these categories. And of course, if you go to the hospital and you end up being assigned a white code, which means non-urgent, you may have to pay a higher ticket compared to the person who went to the hospital and is assigned in orange or red color. The ticket system also applies to visits and exams at the hospital. So it doesn't only apply to emergency situations. So if you have a doctor's appointment at the hospital, so if you're using the public service, we're not talking about the private services offered by private doctors in Italy, which of course you pay for every time you go. But if you're using the public health care system and the hospital, the public hospital, then you will have to pay a ticket also after, or you may have to pay a ticket after a doctor's appointment at the hospital or after an exam. And there are several ways to pay the ticket. You could do so at a window at the hospital right after or before your doctor's appointment, or there are machines in the hospitals where you pay. Basically, it's an automatic system. You pay with a receipt that is given to you, which has a barcode or a QR code, and you scan it and you just pay with your cash or credit card. Or in some cases, the bill will be sent to you to your home after the doctor's appointment. Of course, we're talking about a ticket, which is a relatively small amount in Italy, up to 30 or 40 or 50 euros in extreme cases. And it's not due when there are certain situations, like if you have a chronic condition, or if you are over the age of 65, under the age of 6, or if you have a very low income, you may be exempt for paying partially the ticket or completely.
It's really interesting how the system works when you're visiting the hospitals. Again, like as somebody who came from abroad and accessing a hospital system in Italy, it's a little bit of a different mindset in how it all works. I mean, even my own personal experience having dealt with the system, like having actually had to go to the emergency room there, unfortunately, and one of the higher emergency codes, like it'll also affect like how fast you're seen and how much the service will cost. Of course, like I believe you mentioned that the services will differ from region to region, but I can say, like, from my own personal experience, I had one time that I had burnt my hand, and they had the doctor's visit. They determined that I needed to see the doctor immediately. And they had like a steroid cream that they had given me, and also the visit and the nurse's visit and all of that. And that was, I want to say, 15 euros in total. But also the way that it was interesting to see is that, again, like, kind of coming from an American mindset, like just the way that it worked and the way that you kind of were walked through the process was that there was first an initial window that you would go up to, at least in the instances that I unfortunately had to deal with, or in family or friends that I had to help, that you go up to a window first, you have a discussion with them, you tell them what you're feeling. From there, they'll give you an initial ticket number. It's not ticket as in like what you have to pay, but like a kind of a number that you'll have to wait for. They'll call you. And of course, this could change from hospital and region to region. Then you will have a consultation with a nurse, and that's where you'll be assigned your severity code. But of course, if you're like really in a dire situation, then they will rush you through some of these processes. And then from there, then you'll be given another number or some type of other way of being recognized, or they'll call you or they'll call your name. And then you go, and then you have either another consultation with a nurse and or doctor, and kind of get run through that. And it's really a very different kind of interesting way of going through things, just because, of course, on the system, like, they have to make sure that everybody's taken care of and everybody is attended to equally. So to make sure that they have all their T's crossed and their I's dotted, I was going to say it the other way around, their T's dotted and their I's crossed. Unfortunately, that can happen as well. But another thing I think, though, that's important to understand in Italy is accessing not just the doctors and the hospitals, but also the pharmacies. That's another little bit of a different situation that a person can run into than what they might be otherwise used to. Would you mind to tell us a little bit more about how that works in Italy when you visit the pharmacy? Because depending on the type of prescription you have, and depending on your ailment and how severe it is, and if it's a chronic ailment, then that may also affect your interaction with the local pharmacies that you would have to deal with.
Like I said before, after your appointment with your general practitioner or the specialist, the prescription will generally be sent to the pharmacy automatically through an electronic system. So you will find it already in the pharmacy. And if you have a chronic condition, you might be exempt. Of course, you have to request to file a request to be exempt through your doctor, which will be evaluated by the local ASL. And if your exemption is granted, it means that because you have a chronic condition, that those specific medicines you don't pay for, or you pay a much smaller amount when you go to the pharmacy. Now, when you're at the counter at the pharmacy, it's very important that you show your health card, because that's what determines whether you can be exempt. So they will see whether you have an exemption based on your healthcare card, and also based on the prescription that the doctor has sent to them. And also, some pharmacies are able to perform, for example, blood pressure tests. And during the health emergency, many pharmacies were able to do viral testing and issue certificates. Also, I think it's important to explain that the pharmacies, normally they have in Italy normal working hours, meaning they work from 8 in the morning, generally to 7 in the night, with also a break for lunch. They might be closed for a couple of hours during lunch break. So what happens if you have to go to the pharmacy after working hours? There will be one pharmacy in your area that you can easily find which one it is online, and they will rotate. So it's not always the same pharmacy, but every week there will be a different pharmacy that you can go to, and it's the only one that will be operating after hours. So in other words, pharmacies in Italy, they're not working 24/7. But there will be one pharmacy that is appointed, that is selected for that specific week, which will be operating after hours. Sometimes they're actually open, so you can just go there and walk in. Sometimes they're closed, but you can ring the bell and the person will open the door for you, or there will be a little window where you can communicate with the person and you can give your prescription. They can give you your medicines. And so it's very important, if you have an emergency and you need a medicine in the night, that you go online and understand which pharmacy is open in that specific week after hours. Also, what many foreigners find it interesting when they come to Italy is to see that many pharmacies will have a vending machine outside, which will sell diapers or over-the-counter basic medicines. And I think that's something that doesn't really happen, for example, in America, and it's very unique, and it happens in Italy and maybe in some other countries. But in Italy, a lot of pharmacies will have these vending machines outside.
Yeah, I was very surprised to see that when I first arrived in Italy, to see that not only do some places have like those late night windows that you can access, but also the availability. I mean, even baby formula and other various necessities that a person may need that are just outside of normal operation hours, that don't require any kind of prescription there. And it's great to have access, if necessary, to those things, rather than having to run around trying to figure out which is the pharmacy that's open at night or late at night that particular week. But of course, you can find that information usually online locally. And so just another aspect of accessing the Italian medical healthcare system, the national healthcare system, that would be making appointments and dealing with specialists and so on. Of course, not dealing anything with the private system, but I know Italy has some different ways about going about making these appointments, or how you access that. And how would a person need to do that?
So if you need an appointment with a specialist, of course, what you can do is you can talk to your general practitioner, and he or she will tell you whether you need to see a specialist and which specialist you need to see. Or if you're able to determine that on your own, then the next step is to book the appointment with the specialist. And there is normally a call center. So you call the call, you can just go online and see which one the number to call is in your area, because let's not forget that everything happens locally in Italy, so within the region and also within the ASL district. So you book you call the number and you book the appointment with the specialist, and the voice on the other side of the phone will tell you what is the wait time and where there's availability. So if you have to book an appointment with a cardiologist and you call the number, they will tell you, okay, I have one available in this location, I have another one available in a different hospital, but a little bit later, so this month. And so you will be able to see what the wait time is and where you can go by calling this number. Now, a lot also is done online, so you can simply go online on the website of your local ASL and book the appointment with the specialist, and you can see already there the availability, you can see the wait time. And I think it's important to mention that you can only see a specialist within your region if you're using the public system. So it's not that you can go to a different region, and that's because every region has their own system, and every region is prioritizing the residents of that region. Of course, unless an exception can be made for whatever reason, in which case you can absolutely make an appointment with a specialist, also based on the urgency or the actual specialist that you need. But in a normal situation, you will see a specialist in your own region, and the wait time will be, again, in a normal situation, longer to see a specialist outside of your district. And the reason behind that, again, is that the system prioritizes the residents of that district. So if you want to see somebody outside of your district, the wait time might be a little bit longer.
Yeah, that's an interesting aspect, because there's the two parts of the system. There's the national healthcare, but then the regional aspects to these, and how you're mentioning that you have the ASL offices that are the ones that really kind of take over the local administration of how all of these services work and the booking and so on, and how you're able to actually go through the process of making appointments and actually accessing the system to begin with, and how you get your referral and how you actually make use of that referral. But Marco, just to round out this very comprehensive overview of the Italian healthcare system and how to access it, one part of the healthcare system that isn't part of the healthcare system in Italy is your access to international healthcare. I mean, of course, Italy does offer international coverage for outside of the European Union, but I think that's a very different topic, which might require a separate episode on its own. But if you are wanting to access services in Europe as somebody who is covered under the Italian system, how would you go and do that?
If you are in an emergency situation and you are outside of Italy in another European country, all you need to access emergency healthcare in that country is your blue healthcare card issued in Italy and your ID.
Well, thank you so much, Marco, for really, again, for going over all of this information. I know that it will be very helpful and very useful to many people, regardless of what level of access they need to the system. And hopefully, much of this information will never be needed by those individuals who are going to be listening and watching this episode. But of course, Marco, if anybody who is listening in needs help to get their Italian citizenship or getting set up with life in Italy, how can they contact you and your team?
People can contact us through our website, italiancitizenshipassistance.com, or give us a call. Our number is on the website.
Well, absolutely fantastic. And of course, if you're interested in more information like this about life in Italy and making Italy your home from a legal aspect and all of the different ins and outs of dealing with the Italian system, be sure that you are subscribed to this podcast, both on YouTube as well as the audio-only podcast. But of course, if you are subscribed to the YouTube channel, that means you're also automatically subscribed to the Italian Real Estate Podcast, where Marco and I talk about making Italy your home from a very physical standpoint and practical standpoint of actually dealing with real estate and relocation to Italy, and also talking about different regions and parts of the nation that might be recommended. As well as if you're interested in more information about life abroad and living abroad, be sure to come over to my YouTube channel, youtube.com/Rafael Di Furia, or you can find my audio-only podcast by searching for Not Your Average Globetrotter. But of course, again, Mr. Marco Permunian from Italiancitizenshipassistance.com, thank you so much for making yourself available from this episode. And of course, I'm Rafael Di Furia. Stay safe and healthy out there, and we will see you all next time. Later.
Thank you.